All right, audio. Oh, there we go. Now I'm live. All right, the good news about being out here is I can take my mask off for a minute, or else you guys will have trouble hearing me. Hopefully. We good? Good? Okay. Want to thank all our diehard fans out here tonight. I know it's hot. I know it's crazy. You guys at home, we're going to try and do our best to video it for you so you can see it too. But a couple of things we're going to do here tonight. We're going to talk about acupuncture first, and then we're going to talk about chiropractic, spinal medical manipulation, equine medical manipulation. So we're going to talk about equine medical manipulation, and apparently I need to talk louder. I've never been told that in my life. And we're also going to introduce Dr. Yorke for those of you guys who haven't met her. If you're on Facebook, feel free to ask questions, and we will ask away on our questions. For those of you here, at the end, we're going to have our contest for best mask. And despite the fact that there are not many of you here, it's going to be a tricky contest. So anyway, without further ado, I'm going to let Dr. Abbott get started, and she's going to demonstrate acupuncture and what the principles are, some of that kind of stuff, on her volunteer horse, Sly. So there we go.
Stop. Danny, you can come hold him, or Helen's coming. Okay. All right, can you guys hear me? Okay. So acupuncture is kind of an interesting topic to talk about. There's a whole long list of things that we look at with the horse when it comes to acupuncture and making a diagnosis and doing treatments. I like to look at it as a new perspective on basically what we would normally do as far as diagnosing your horse in the normal way. You know, when we would come out and we would come and talk to you guys and give you a diagnosis from what we learned in vet school and all that. But acupuncture, or as we like to call it, traditional Chinese medicine, kind of goes a whole nother realm. So what I'll do is with Sly here, I'll kind of go through what I would do if I came to your farm to do an acupuncture treatment. I really like it when owners are there because I get to find out more about the horse. So luckily Sly is mine. I've had him for a really long time, so I know a lot about him. He can eat for right now while we talk about this. But the first thing I want to do is kind of figure out, okay, what's his personality, right? So I'm going to ask the owner, hey, so in the herd situation, is your horse dominant? More importantly, does your horse want to be dominant? So you may have a horse that is forced out of like their desire to be the dominant horse because there's another even more dominant horse. Is your horse competitive? Do they enjoy going to competitions if you do that kind of stuff? Are they playful? Are they super friendly? Are they kind of that in your pocket kind of horse, or are they kind of the ones that are like, cool, you fed me, see you later in 12 hours when you feed me again? A lot of that plays into what their personality is. And their personality is based on elements. So you can have a wood personality, a fire personality, water, metal, or earth. And I know because of Sly and how long I've had him, he's most definitely the dominant horse in my pasture. He is in charge. Everyone follows him. They do what he says. He was super competitive when I was competing on him before his semi-retirement. He's a little bit playful and he's friendly. So for me, that tells me that he's a wood personality. A fire personality is going to be that horse that's in your space, like 100% always in your space, wants to be on top of you, loves you, will play with anything. You give them a ball, they're going to play with it until they pop it, and then they're going to play with that popped one until you give them a new one to pop, and then they're going to have all of those, and they're going to just be playing forever and ever and ever. But not necessarily the most dominant horse. They're just the ones that just really want to be with their person. They want to play. They want to do new things. They think going and exploring new places is super fun. A metal personality is that red-headed mare. Cool, you fed me, I'll see you later. You're feeding me again, cool, I don't need you for anything else. That's your metal personality. And then earth and water are a little bit kind of not the most common to see. Water personalities, if you watch horses in the wild, do not exist, because these are your horses that are basically they're the boy that cried wolf. They're, oh my God, that leaf blew. it's going to kill us, and makes the entire herd run away. And then they're like, oh, never mind, I'm going to eat. And then they do it again. There's been some research done just by watching the herds, and what they have actually seen is that those horses get ousted. The mares and the lead stallion of the herd kick them out. And then obviously they're not going to survive without their herd, right? So we can create those very easily just by making horses nervous and anxious and all of that, but they don't really exist. They're man-made. So, and earths are a little bit of a combination of kind of all of the above. Again, we don't really see a lot of those. So, knowing this, I know Sly is a wood personality. So we're going to talk about that, figure out what personality your horse is. Then what I'm going to do is I'm going to come and hang out with your horse for a bit. And I'm going to say, hello. Hey, get up here, Bubba. And the first thing I'm going to do is I'm going to check their tongue color, check the moisture of their mouth. His is just a light pink. He's a little bit moist. Sometimes they're dry. They can be red. They can be purple. They can be very, very thick and swollen. They can be very thin. All of those different aspects play into what our traditional Chinese medicine diagnosis becomes. Then what I like to do, and sometimes they don't like it because some horses hate their ears touched, but I like to feel their ears. I feel kind of with all four of my fingers, I feel the base kind of all the way to the tip. And typically, you know, they should feel fairly normal, fairly uniform throughout the entire ear. Sometimes the tip will be a little bit cooler. Obviously, it's at the tip of the extremity, but in a horse that has maybe some deficiency or maybe some stagnation or something like that, and we'll get into what those mean in just a minute. But what they'll have either a lot of heat or they'll actually be cold. So then I run my hands down the horse, run it down their back, feel their withers, I feel their thoracic spine here, I feel their lumbosacral area and all the way down. And what I feel for there is, again, temperature. And I feel if it's all kind of feels the same, if it feels a little different. And then from there I put that kind of in my head as to where I'm ranking and what I'm coming up as far as the diagnosis. And I also take into account that it's 100 degrees out. So they're going to all be a little bit warm right now, right? But if I'm running my hand down Sly's back right now, right here it's warm because he's hot. But when I get to right up here in his lumbosacral area, he's actually quite warm comparatively. So I note that in my head. And then I come, hey Bubba, and I like to check their pulses. So I check them on both sides. So I just kind of run my hand down here, and I just feel on the left and on the right and decide, how do his pulses feel? Are they strong? Are they bounding? Are they weak? Are they really, really kind of light? Or do they feel strong and deep and are they almost bounding? And based on all of those, I have in my head where he kind of ranks in his diagnosis. And so then from there, what I do is I do my scan. And so for this, he'll need his head up, and we'll turn him sideways. Good boy. And so what I'm scanning for right now is I'm scanning along the meridians or the channels. And there's 14 different meridians that we check and that are associated with different organs in the horse. So for him, the first thing I do is I kind of scan right here. This is their, this will tell me kind of if they're really reactive. It's either their TMJ, so they may have some arthritis or they might be sore in their TMJ. They may have ulcers if they're super reactive there. One response there isn't going to tell me that they have ulcers. It's a combination of many different things. So then we scan, and so they might shake, you know. So then we go back and we scan again to see, okay, was that real? Was that a response? Did he not like that? Or was he just shaking? And he was just shaking. And then we kind of scan. You can see he's kind of a little bit responsive right here. He kind of moves away from me. He doesn't like it. He's going to push Helen out of the way. But overall, his neck, you guys see that one where he really doesn't like it? He's getting mad. He's throwing his head. And I go back to it, and he keeps doing it. So to me, this is a very, very positive area. And what this tells me is that we need to figure out why this point is bothering him. And it may not be that he has a pathology or something sore right here in his neck. It may be related to his feet. It may be related to an internal organ. So we have to keep kind of digging and find more things to tell us. And here he's kind of not really responsive there. We keep going, we scan, you see, he doesn't really do anything there. And then we scan the entire bladder meridian. So you see how he's kind of twitching his skin here? I don't know if you guys can see that on Facebook Live, but he's twitching his skin when I scan right here. So this point here and this point here tell me front feet probably hurt. So you guys see what I do and how we help that. You see right where I said he was starting to get really hot, super sore, right? He's kind of buckling under there. And then we kind of finish scanning, a little bit responsive, but not bad. And scan around, and again, a little bit responsive here, not bad. So then what I would do, I'd do it on the other side. For sake of time, we won't do that. We're gonna put a few needles in him and see if we can't help him feel a little bit better. So we start with byway, and that's my permission point. That's gonna be how I can tell how your horse is gonna respond to the acupuncture needles going in. So we're gonna find byway. And we're gonna stick a little needle in it. Maybe. And right now, it's really hard for me to get this needle in. And it's not because there's bone there or anything, it's because he's got a blockage, or what we call stagnation, which tells me that there's pain there. And if I can't get it there, I may try a different spot, but I'm gonna try. I don't like to keep using the same needle. These are all very fine needles. They don't have any hollow part to them like our hypodermic needles do. But I am gonna try and redo that spot and see if we can't get it. But that tells me that he's got a lot of stagnation, and what we mean by stagnation is we mean pain. Good boy. I know, buddy. And you see how he responds to that there. And it's like going through concrete right now. And then once we relieve it, it goes in quite nicely. My next favorite point to do on almost every horse, and again, it depends a lot on the horse's personality as to if I'm gonna do this point, but we like to do what's called liver 3. And liver 3 is an overall relief, like it helps chi to get moving. Chi is energy. Chi is the blood source through the horse's body. And so I like to do this one because you'll see a lot of horses respond really, really well to it. Oh, Bubba. But again, you'll see where I'm going and why I might not do this on every horse. Good boy. Move your tail. Good boy. You might see him do a little bit of licking and chewing, although Helen's giving him a treat, so he's going to be doing licking and chewing no matter what, which is totally fine. Some horses who are needle shy, we have to do something a little bit different. If they don't like needles, we can still do acupuncture, but what we like to do, we don't like to sedate them, because if we sedate them, what happens is we can't get that energy moving, we can't get the chi moving, we can't relieve stagnation. So what we do with those guys is we actually start them on herbal therapy before that. We start them on herbal therapy, it helps just relax everything, depending on the horse, depending on their personality. Do that for maybe 2 weeks or so, and then we come back and we try and get maybe a needle or two in to help them. And then we kind of build from there. So I'm gonna do liver 3 on the other side. Oh, bub. Or I'm not. You're fine, buddy. And sometimes they'll kick it right out, but if you just get that initial kind of point in, it actually is effective. So I'll do a couple more points on him. We're not gonna do a full treatment just because of, time and everything, but I'll get a few more points in. I'm gonna do some for his front feet, see if we can't get those feeling better. And then I'll rescan him and show you guys kind of how quickly it can work. So. Hey, big man. It's not food. I knew you would like for it to be food, but it's not. We'll do one here. We'll do a couple kind of down here in his SI, see if we can't help that a little bit. Huh? Was he licking and chewing? Good, you like that. That's good. Yes. Kind of go couple here. See if we can't help here a little bit. There you go, buddy. That's a good boy. You can do relax now, deep breath. And we look for deep breaths. We look for licking and chewing. We look for them just to kind of relax a little bit. And you see, he's kind of been pushing Helen around this whole time, and now I've put in a couple needles that have kind of just taken that edge off. And he's licking and chewing a lot. Doesn't like the bugs, but that's okay. I can't blame him. And whatever we do on one side, we try to do to the other side, because we want them to be nice and even. You go, boy. And then, so while we're doing kind of dry needling, this is what this is called, there's other modalities that we can use when we're doing acupuncture. We can take these needles that we have in, and we can attach them to electrodes. And they'll give them, it's not like a electrical shock or anything, it's a constant stimulation of the acupuncture point, which is really good as far as getting things moving, getting rid of pain and all of that. The other thing we can do is, like we talked about, we can do some herbal therapy. We do a lot of herbal therapy for your non-sweaters. Those guys do fantastic on herbals. It really helps, because what it is basically like acupuncture every day for your horse. And we can do what's called moxibustion. So if you have a horse that's got some areas that are super cold, there's one I've been treating actually recently that you run your hand down her back and she is normal, even in all this heat, she is normal. You get right here and it is like ice. It is so cold. And moxibustion is a way of introducing heat. You just take this, it smells very, very bad, but it's a little stick, and you just kind of run it over any of the points in the area where they're cold, and it helps to heat them up. You can also do acupuncture, which is injecting basically B12 into these points. It makes it stay a lot longer. Hey, Bubby. I'm gonna do one right here. I know, you don't like it. You're a good boy. And then what I'll do, after I get this one in here, if this one wants to go in, it may not. But again, you see, like concrete, and then all of a sudden it just sinks in. I would expect him to have a bit of a response to that one. He may not. He's not going to, because I expected him to. So what I'll do, oh, got your response? Okay. So what I'll do now is I'll kind of rescan him and see what I've got, see if he's made any progress. And if he's still super reactive, or if he's just kind of like, you know, the same. So we weren't expecting much there because he wasn't responsive there. I'll kind of go around, but you guys see he's not responding, not moving away from this at all. And then we'll go down his back here. Still a little bit through here, but not nearly like he was, right? He was like shivering me off like a bug before. Nothing. No dip in his back at all. Just from those few needles. No dip back here. Literally just those few needles, and he feels better. You can see in his personality too. He's not pushing Helen all over the place. He's just feeling better overall. So from here, I'd hook him up to our little electro. I'm not going to do that now, but I'll show you guys it. Hook him up to this little machine here. Turn it on 15, 30 minutes or so, depending on the horse, depending on how they tolerate it. There's all these little wires that we hook up to the needles and slowly adjust them and how they respond. Like I said, it's just constant stimulation for them. But that's pretty much what an acupuncture treatment is. Most of the time at the end of it, I will recommend an herbal for them. Sometimes not. Sometimes they don't need it. And then from after we're done, I like to recommend how often we need to see them. So that with how he responded and how well he did, I would say he would probably be okay to go 2 to 3 weeks before another treatment. Other horses, because of how much pain they're in or how severe their illness is, for example, if your horse has heaves, we can treat their heaves with acupuncture. Those guys I like to do a little bit more frequently, depending on how bad they are. If they're having a really hard time breathing, I'm going to do those guys every week. If they're moderately controlled in their breathing, maybe every 2 weeks or so. Just really depends on the horse and how they respond. Usually the goal is to get them down to maybe once a month on an acupuncture treatment. So, and that's it. Anybody have questions? So the initial treatment, which is going to give you your initial workup and diagnosis and whatnot, which we do every time, but the first time it takes a lot longer. And we get a lot more kind of, okay, we need to find out all of the things about the horse, right? So that one is $200, and then follow-up treatments are $165. And the herbs vary in prices depending on what herb it is that we need. All right, so we're gonna get Dr. Yorke in here. I'm gonna take the needles out of Sly, and then we'll get her in here to help out, or he'll get his spinal manipulation here. So let me pull these needles out of him real quick, and we'll get her in here. Good boy. And oh, this is kind of fun. You guys see how that bent? I don't know, can you see that on Facebook there? No, I'll walk over there. Give me a second. Just because it's really kind of fun. Now you can see it. So you see how that bends. And so you guys remember that point he was super reactive to, right? And then you saw afterwards he wasn't reactive. Clearly we did something, right? Like, you don't just bend needles just by sticking them in. You'll see. I'll pull others out straight. So he had some stagnation right up in here or in his front feet. Probably in his front feet, knowing him. We'll get these out of here. Good boy. Good monster. And then we'll hand him off to our team members here. Janelle and Dr. Yorke will take over, and here we'll go.
All right, I'll start over. I'm Dr. Yorke. Glad to see you guys here and looking forward to talking to you about equine medical manipulation, also known in the human field as chiropractic. All right, so when a veterinarian is trained in performing this process on horses, we're going to call it EMM, equine medical manipulation, but really it's the same process as what you're more used to calling chiropractic with human fields. All right, so I'll talk a little bit about what it is and why it's important. So when we think of chiropractic, sometimes there's a simplified idea out there of we're just cracking bones, or the bone is out and we're putting it back in. It's a lot more complicated and a lot more fun than that. So basically, I'm going to start by dispelling that myth that the bone is out. So I'm not going to talk about a hip being out or a rib being out, because the bones are in the horse, right? If I took an x-ray, the bone would still be in the horse. So what we actually have going on when we have a restriction that we come in there and manipulate and make the horse feel better is we have two bones that are supposed to sit together with motion. All right? So there's normal motion that occurs all the way down the axial skeleton, the neck, the back, and down the limbs too. So we address all of those. Now what happens when they have a restriction is that for one reason or another, either chronic pain or an acute accident or something like that, something is preventing those bones from being able to move. All right, so maybe it's a muscle spasm, maybe it's something to do with the joint capsule, but for whatever reason, we don't have normal flexibility between those joints. And bad stuff happens when that occurs. So it can be directly in the joint itself. When the joint can't move, it can't get the appropriate nutrition from the joint fluid going in and out that naturally nourishes that joint. So it can be an effect directly in the joint, or it can be something that translates much further out into muscle pain, into the nerves that are coming out of the axial skeleton and affects further out in the limb. And it can even affect behavior, okay? So if we think about what are things we might want to call the veterinarian equine medical manipulation specialist if we see going on in our horse, it can be pretty wide ranging. So things that affect horses' behavior, you could see things like tail swishing, bucking, unhappiness when you first sit on the horse's back, when you sit in the saddle, okay, they duck down, something like that. Can be heaviness in one rein, lack of flexibility to one side versus the other, lots of things, okay? Now, one concept I want to address is that a lot of times we blame horses for not doing the things we want them to do, thinking they just don't want to do it. Now, a lot of the time, horses don't decide to not do the things we want just because they feel like it. They have a hard time doing it for one reason or another. Now, it can be training, of course. Sometimes the horse just needs to work through that. But a lot of times there's restriction or pain that prevents him from being able to bend as nicely one way as he can the other way. So that's one of the many reasons we can use this modality to improve the horse's comfort if he's a pasture pet, or if he's a performance animal, to improve his ability to perform. Okay. So what I do when I do an exam, I like to have the owner here. So if Dr. Abbott's willing, she could answer a couple questions for us about Sly. So I do like to talk to the owner about what they're noticing with their horse. Okay. So what problems are they having at home? What are they noticing when they sit on the horse? Are they having trouble one direction versus the other? So sorry to throw that on you, but I'd love it if you would tell us a little bit. I haven't met Sly before, so it's great to get that information.
So,
and then,
can you guys hear me? Is that good? Okay. So I'm going to stay over here. So I'm in my social distance because they're one team and I was with my team. So I'm going to hang over here. So, okay. Yes, I'm happy to help with any questions.
Yeah.
What you got?
So, what do you notice with him, either just, in his comfort at home or when you're riding him? Anything you notice that's different one side versus the other, or different from his normal behavior?
So, he's kind of semi-retired at this point. He doesn't do a lot. But on the rare occasion that I, hop on him because he's perfect and he's fun, I will notice that he's kind of more stiff to the right. He's a pretty flexible horse, but he's definitely more stiff to the right. And he does have a kind of intermittent lameness of his right hind leg that comes and goes when I'm riding, which is kind of interesting to me. He'll be trotting along perfectly fine, and then out of nowhere be holding his right hind like this, and then he walks forward and he goes fine. And he really sometimes, for me, he doesn't like to always kind of come up under himself. He likes to more just kind of trail behind, be a little bit lazy. Yeah. But otherwise, he's pretty good. No issues with leads or anything like that.
Okay.
Yeah.
That's a great history. She brought up some of the really common things we like to ask. Leads, either picking up the canter lead or switching leads when they're not supposed to, or having difficulty when they are supposed to be doing it. Stiffness in one direction versus another. And another really common one is coming onto the bit. Like, will they flex at the pole to come up on the bit like they're meant to? So thank you, Dr.
That's
Abbott.
good. Okay.
All right. The next thing I like to do is watch the horse moving. It's a little different than a regular lameness exam. I'm going to be looking for some motion in his head and his pelvis. So, Janelle, would you like to just walk him? You can go. So I'm looking at two things. I'm looking at his pelvis here like it's kind of a box, and I'm looking to see, is there equal motion on both sides? And then I'm going to look and see his head is moving in a figure-8 pattern. Horses, when they have good flexibility in their head, they'll move their head in a figure-8 pattern equally to both sides. Now, another thing I do, it's kind of a holistic exam. I look a little bit of everything. Look at how he postures himself. So is he standing square? Is he standing with his legs, one at each corner like they're meant to? Or is he standing with either his front legs too far underneath him or his hind legs too far underneath him? And I also look at his shoeing and trimming, because horses are very, very sensitive to the tiny, tiny changes we can do, especially to do with their feet. So we address that, and he's lucky to have a good owner. So Dr. Abbott has taken good care of him, and his feet look in good condition. He's also standing, when he gets the chance, with his legs underneath himself. And then I'm also going to look at the symmetry of his muscles. Is he well muscled? Is there any less muscling on one side versus the other? Take a look at the whole horse before we go up and put our hands on him. On that, I'm going to move that along in the interest of time. We're going to come up and you can bring him a little closer, maybe. This way. That's great. Okay, so I usually start at the horse's head and get to know them, get them used to me before I start working on their back and their hips and things like that. So I'll come up and I'm going to start palpating a few areas of him, and I'll talk to you about what I'm moving when I'm doing it. So I'm looking for normal motion, and this can be very, very small motion, like in the TMJ. It can be larger motion, like with his head. So I'll come up and I'll put my fingers in a specific anatomical place, and I'll feel it to see, is there a little bit of micro motion like I expect there to be? And if there is, good, he's in good shape in that spot. And if there isn't, that's an area that may be in need of an adjustment. So what you'll notice as we get going is the adjustments are relatively unexciting looking. Okay, they're not big pushes. I'm not going to pick up the horse and pull him around. They're fast motions in a very specific place. We call them high velocity, low amplitude. So it's a very specific place and a little click. Doesn't look like much, and it shouldn't look like much. Okay. So his TMJs are in good shape. He feels like he's got a nice normal amount of motion here. The next thing I'm going to come down and feel is, it's called the basihyoid bone. It's attached to his larynx. And I like to feel that bone right in the center of his mandibles. Sometimes horses that stick their tongues out a lot when they're being ridden, and kind of very mouthy horses, they play with the bit, they throw their tongue out when they're under saddle. They can have restrictions in this bone that make them feel like they want to play a lot. So I always like to assess that, and he feels fine. Okay, we're going to travel down and feel the bones. Hi, buddy. Of his atlas. Okay, and he's moving like he should there. Okay. Now, I'm going to do an adjustment, and I generally do these on every horse, of the pole. So this may take a minute for him to let his head settle down and relax down. I don't rush this. I like to be patient so we don't lose their trust in this. But we're going to take our time and see if we can bring his head down. And then I'm going to very quickly sweep it up. So sometimes it looks like a spook. I like to warn people it can look quite quick. So we don't think that's something unintentional. That wasn't it yet. All right. And what I meant to tell you before, and he demonstrated for us, there's ways to tell if what we did affected him in a positive way. I definitely feel before and after I adjust to see, is there more motion in the joint than there was before the adjustment. That's what I want to see. And then the horse also likes to tell us his opinion. So good things he can do, licking and chewing, deep breaths, similar to what Dr. Abbott said when they were doing acupuncture. Say licking and chewing is applause, deep breaths, things like that. And when they lift their head like that, that's a standing ovation. Okay, so he's expressive already for us. So we can do that on the other side. All right, he appreciated that too. Hard to hear over there in our Facebook Live is there was a little bit of an audible, which is the noise we talk about when we crack our joints. You hear that little pop. Horses only sometimes give us those pops. There's a couple locations we get those, but we don't really expect to hear them everywhere. But he did have a little audible on that side of his pole. So from there, maybe I'll turn this way a little bit, what I'm going to do is I'll put my hand on the bone, between the bones of his vertebrae, and I'm going to motion him back and forth to feel where he's moving like he should. And he is a little restricted here. Did you see how he took a few steps away from me? Sometimes when you're in a spot where they feel a little restriction, they'll kind of either push into you or push away because they don't like it with that little bit of muscle tension they have. So we'll give him a minute and see what he thinks about that. He didn't like that as much as his pole, so we'll keep coming down. He's moving pretty well on the caudal aspect of his neck. Okay, so he feels pretty good here. Next thing I'm going to do is take a feel of this muscle here. Do you guys see this muscle right along the shoulder here? This muscle right in front of his shoulder. I like to assess how tense that is. Okay. Horses that have some neck pain and horses that have some front limb pain are often tense here, and it's kind of like the way you feel if you have tense shoulders that need a massage. I like to kind of come down here and see how tense this muscle is. I should be able to get about half my hand underneath that muscle there. And he's a little tense here. A good thing you guys can do at home with your horses is just take your hand and rub that back and forth, just like a shoulder massage for your horses. You won't hurt them doing that. Okay, so we can come and assess his front legs. Oh, he's very good. All right, so the next thing I like to do is to pick up his foot, and I'm going to think about it like a jar, like the lid on a jar. Okay, so I'm going to grasp it like I was opening or closing a jar, and I'm going to move it back and forth. Let's turn him a little bit so we can, yeah, just be better for the camera. There we go. Good boy. So I'm going to grasp it back and forth and see how much motion I have. Okay, I should have a nice little bit of motion out of that coffin joint. This is a nice thing to do when you're picking your horse's feet. Just pick it up and gently motion it back and forth. Helps to break down any microadhesions in that coffin joint. Just helps to free it up and give him a little flexibility. You're right. Okay, so I'm going to come in front, and we're going to see if his accessory carpal bone wants to adjust. All right. Good boy. Good boy. Good boy. All right. Okay. Hi. All right. Going a little faster than we usually would, just in the interest of time. The exam usually takes just about an hour for a complete assessment, especially in the beginning, and then to adjust everything that needs to be adjusted. We travel with our adjusting bale, which is a little handier than a hay bale or a chair to stand on, and I'm less likely to fall off of it. So that'll allow us to come up here and assess his back and his withers. So I'm grasping his dorsal spinous process, the bones of his withers, and seeing how much they wave back and forth. They should have a little bit of flexibility when I push on them. I can come to him. That's fine. There we go. Okay, so we'll push those back and forth, and he seems like he's got some nice flexibility in his withers. Then we can test the tension of his back. He's a little tense here in his lumbar back, which is fairly common. Right here. Okay. Let me see if he'll take one step up. Great. So then the next thing I'll do is I'm listening with this hand here. I'm feeling for the motion of those vertebrae coming back and forth. And I'm going to rock his body back and forth just to put a little bend and see, do I feel the motion under my fingers that I should? There you go. Good boy. Oh, buddy. All right. His patience minutes may be gone here. That's all right. So just for demonstration purposes, we'll move on to his. So one thing I like to assess, and this is a really good thing for any of those horses with hind end issues, either purely caused by restrictions like equine medical manipulation restrictions, or with other things going on, hock arthritis, stifle. It can all manifest in other ways and affect the rest of their body. To assess the motion of their pelvis. So what I do is I put my hands on top of his tubercocci, the bone here in his hip, and I motion him up and down. And I like to see how much motion, how much rocking I can get out of his back. So he's standing nice and square, and I'm pushing on this, but I'm not getting a lot of motion out of his pelvis. So we'll look at the other side and see if we get any more. So let's see, which side did I just do? The other side? All right. So this is the other side. Let's square him up just a little bit. There you go. It's okay. There you go. So, can you guys see that? There's a lot more motion on this side than there is on his other side. Okay, so I'm pulling at the same strength as I was on the other side. And this side seems to move pretty freely. The whole pelvis and back, you kind of see it moving. The other side is like pushing on a brick wall. I was really not getting a lot out of that side. So that tells me there was a restriction on the other side, which goes along with the fact that he has a history of right hind lameness. Let's turn him. So just walk him up a few steps. There you go. Oh, pumpkin. There you go. Good boy. So we're going to go ahead and adjust his hip on this side.
I'm going to be a wall.
Thank you. And we'll do that a couple times. All right. So let's turn him around again and see if we get any more motion out of that. Just square him up. Yeah, good boy. I don't know if you guys are able to appreciate the difference there. There's a lot more motion, and I'm actually pulling a lot less hard than I was trying to before. So that was an adjustment of his ilium. We say it's a posterior inferior ilium, which basically just means his ilium was restricted in one direction. We did a little adjustment to allow that to free up, take the soft tissues surrounding those joints, and just allow them to move a little bit more freely. So that's the basics of it. That was a very small taste of the full exam. We usually find that horses, by the time we start at the front and get to the end, they're maybe a little resistant, a little excited in the beginning. By the time we get to the end, they're usually falling asleep and just letting us do whatever. But any questions about what we talked about here?
Is there a point where a horse has been old and arthritic for so long that it's really not feasible to do something like this? Or?
Well, the question was, if a horse is really old, has been arthritic for a long time, is there a point to doing this? I would say yes. I would say you're looking for improved comfort more than you are curing something, right? So if we have a young horse, maybe like an acute traumatic injury, that may be a situation where we adjust the horse several times. We can get him back to what his baseline is without any hindrance from the issue. On an older horse, you're generally having to do more adjustments and kind of keep the process going and have tempered expectations for what our end goal is going to be. So we're not going to take an old arthritic horse and put him back to being a 3-year-old, running around. But it definitely can take a horse who's got chronic issues and make them more comfortable living their life of whatever they're doing. Yeah.
How do the two work together? And you'll have to repeat my question because I don't have a microphone anymore.
So the question was, how did the two work together? And actually that's a perfect example as well of the older arthritic horse. A lot of times those guys, they're not the easiest to adjust from my understanding, because they are older, they have chronic muscle spasms and chronic stagnation or pain. So we really like to do some acupuncture on those guys, get them relaxed, get things moving, get their chi moving, get their energy moving, and then that makes Dr. Yorke's job a lot easier as far as coming and doing the adjustments. And along with that as well, we have, you guys all know, but for everybody on Facebook land who doesn't know, we have the FES as well, which we really like to use in conjunction with all of it. That's like their, nice relaxing massage to start. Then we get into the deep tissue massage with the acupuncture, and then Dr. Yorke can come in and do her adjustment really well. Other questions? Facebook questions?